Hello. How are you? Good. I'm Nicola, the audiologist here at Clear Ears. It's great to meet you. I believe this is your first time here at the clinic. Well, it is a pleasure to have you here. And I just want to say that you are in perfectly safe hands here. Anything that I carry out here in the clinic is perfectly safe and nothing hurts, alright? Yes, we do have some patients come here and they are a little bit apprehensive and they're worried that things are going to hurt, but no, it's very simple, alright? Okay, so can I take your full name? Perfect. And your date of birth? And can I have a contact number? Great. So you are a new patient. And which is your GP surgery, please? And who is your doctor? Great. Right, and can I take the first line of your address? Great, and just a postcode. Good. Thank you. And is it okay if I have an email address so I can email over you your results? Excellent, thank you very much. Don't worry, I won't be spamming you with all sorts of different things, alright? It's literally just so I can send you your report, alright? Yeah. Okay, so I'm not going to ask too many questions today. I'm all about getting the assessment carried out and actually having a look in your ears and carrying out several different hearing tests, okay? So there's not really a great deal for us to chat about. But I do want to ask, how much issues are you having with your ears? Yeah. Okay. So are you saying like, sorry, what did you say? A little bit more often? Yeah. Okay. So you say that you are struggling to hear, and you're having to have the TV a bit louder than usual. Okay. And you're asking people to repeat themselves. Okay. You don't wear any hearing aids or anything at the moment. Okay. Have you ever had any issues with your ears at all? Anything with tinnitus, ear infections, buildup of wax, anything in particular? Okay, so all good. All right. What about any family members at all? Have you got any history of hearing problems? What about any ear issues? Okay, so hearing loss in the family, okay. When you were younger, did you ever listen to really loud music, bassy music, really loud music on your headphones or anything like that? Oh yes, I used to do that as well. It's terrible, isn't it? But that can actually impact. Okay, so just jot that down. Music. I do like it now, actually. You know, sometimes I like getting in the car, I'm in a drive, and literally blaring sunglasses on, you know, window down, but I usually have the aircon on, but you know what I mean. Yeah, it's terrible, isn't it? It's really good though. Anyway, okay, that's fabulous. So, because you've got a history of hearing problems, there is a high chance that you are going to have hearing problems, all right? Not necessarily to the same, you know, extremes, but it can obviously be genetic and run through the families, all right? And who in your family has hearing problems? Okay, so you're looking at uncles and grandparents. Okay. And I take it they wear hearing aids. Okay, and do you know how long they've had those issues? Right, okay, that's very interesting. Okay, so maybe it's from your mother's side then. Okay. I know I've asked you if you've ever had any issues with your ears, and you said no, but I would like to know if you've ever had your ears syringed or cleaned at all. Okay. And what about any hobby ear candle treatments? Okay. Great. What do you clean your ears with? Okay, I thought you were going to say Q-tips then. I'm glad you didn't. Oh yes, I don't like those things. Really not good for you. Please stay away from them. Okay, that's that. Do you ever have any ringing, popping, any muffled sensation in your ears at all? Anything that's there continuously or comes and goes? Okay, so just the muffled. Okay. And how often's that? Okay. Do you ever have any dizziness, any vertigo, blurred vision or anything like that? Okay. That's good. So you're not experiencing any issues physically, which is great, apart from obviously the muffledness, but if you are having hearing problems, that is quite common. Okay. And you've had no ear infections, have you? Okay, I'm just checking. That's really good. Have you ever had drops in your ears for anything in particular? Okay, that's good. Perfect. I don't need to ask you anything else, but is there anything you would like to ask me or tell me? Are you sure? Perfect. Okay. Right. Perfect. That is the boring stuff done. Let's pop this down here. So, as you can see, I have a range of things on here that I'll be using today. Alright, there's nothing to worry about. I know some of the things look a little bit scary, but it's perfectly fine. Okay, so what I'm going to do first is have a really good feel around your ears and in them, okay? Just with my hands, okay? Then I'm going to get my otoscope and I'm going to have a really good look inside your ears, alright? Then I'm going to get my special camera pen, and it has a light on the end of it, and it is attached to this app on my phone, and that is where I can get a really good look inside of your ears, your eardrum, the ear canal, and really deep within. And I'm just looking for any damaged eardrums, anything abnormal that shouldn't be there, any obstructions, all sorts of things like that, any impactions, okay? And I'll be able to see if there's any infections deep within. Okay, so it won't hurt you, all right, but at some points you may feel a little bit uncomfortable, All right, a little bit of pressure here and there, which is perfectly normal. However, if you do start to experience really lot of uncomfortableness and real sharp pains and things, please let me know straight away. All right, it's very important that you do. Okay, but I'm sure it'll be perfectly fine. From obviously the little chat that we had, it seems everything will be okay that way. All right, then I will be carrying out a series of different hearing tests. Okay, in no particular order. I'll be doing a tuning fork test. All right, then I'll be using all sorts of different objects to make different sounds and in different positions and things like that. Okay, then I'll be doing a pure tone audiometry test. Okay, so that is where you pop on these headphones and I do different beeps and you have to press a button when you hear the beep. Okay, but I'll explain that when we get to it. That's one of the last things I'm going to be doing. All right, okay, brilliant. So, any questions about anything that I'm going to be doing today? Perfect. So, I'm just going to pop on some gloves if you want to get yourself comfortable. All right. If I am concerned about anything, I can actually refer you to an ENT specialist, okay, and they can carry out further tests and things like that. Yeah, but hopefully that won't be necessary. Are you all comfortable? Great. Am I okay if I now feel around your ears? Perfect. Okay. No, you can stay exactly as you are, that's perfectly fine. Alright. I take it you've never had any discharge or anything come out of your ears? Good. How's that feeling? Great. It's all great, it feels fine. I can't feel any lumps, bumps, or anything that shouldn't be there. Okay. Now, this is an otoscope. I'm guessing you've seen one of these before. Okay, I'm just going to put that inside your ear. Alright, just have a look. Okay. You may need to tilt slightly. Okay. You ready? There we go. Wonderful. Keep nice and still for me. Mm-hmm. Is that feeling okay? Good. Wow. Looks nice and clear. There's no build-up of wax, which is great. And at the moment, no obvious signs of infection. And no reddening, no swelling. And I can't smell any strange odours or anything, so that's good. Just going to go a little bit deeper now. That's it. Excellent. Okay. How's that? Good. Now, I'm going to go to the other side. Okay. And here we go. Yes, all looking okay again. No blockages, no reddening, no swelling, no strange odour. I'm just going to go a bit deeper. Does that feel okay? Good. Great. That's all done. Is that okay for you? Good. Great, so that's all set up. That's just connected to the system as well, so it will copy it over. Alright, so let me just pop this inside your ear. Okay. Great. Now I need you to keep really still for me. This gives me a really good view. Doing really well. Not too deep at the moment, so they are just taking pictures as well as recording the footage, okay? Is that still feeling okay? Good. Good, it's looking good so far. You're doing well. Mm-hmm. That's looking good. Right, I will have to go deeper now, so this is where it may go uncomfortable. Okay. That's it. Good, well done. Good. That's great. Can't see any damage whatsoever, which is fantastic. Okay. Is that all right? Good. Just make sure that's transferring. Check that screen. Fantastic. Let's pop this one, that ear. proceed? Good. Okay. Swap hands actually, that might be a bit easier for me. Okay. That's good. It's looking good so far. Okay. Is that feeling all right? Good. I'm going to go deeper now. There we go. All right, you're doing good. Well done. Excellent. Okay. Wonderful, my love. So, how was that? Not too bad. Okay, good. So, everything looks perfectly healthy. Alright, I can't see any problems whatsoever with your ears, okay? Internally and externally. Okay, so I'm very, very happy. So now we're going to move on to some hearing tests. Alright, so now these tuning forks all have different pitches. Okay, so I just want you to listen. Could you hear that? Okay. Could you hear that? What about that? That? Can you hear that? All right. And one more. Could you hear all that? Any in particular? Okay. With these ones, I'm going to do something a little bit different. Okay, so I'm going to tap it first, and I want you to tell me if you can actually hear the sound. All right. Then I'm going to do just several different places and tap it again, but I just want you to listen and tell me when you can't hear it anymore, or when you get to a certain level, if it just doesn't change and you can still hear it. Just let me know and then I can stop. All right, does that make sense to you? Wonderful. So I'm going to tap it first. Just listen and tell me if you can hear it. Okay, so now we're going to do the second part of it. Okay, so tell me when you can't hear it anymore, or when it basically just keeps going the same. All right. Could you hear the difference going side to side? Okay. Okay, you can tell me if you can hear this. Okay, and second part of the test. Could you hear it going side to side? Okay, can you hear this? Second part of the test. Could you hear that swapping? Okay. Good. Second part of the test. Could you hear it swapping? Wonderful, well done. That is the tuning fork section complete. So, how did you find that? Yeah, I think you did very well. All right, so let's move on to the object test. So, I have random different objects here. Okay, just going to make different noises with them, and I just want to tell me if you can hear it. Okay. Good. I want to listen very carefully. So listen to that noise. Okay. Good. Yeah? I know, I love it too. It's great, isn't it? This gives me an excuse to play around. Okay. Can you hear that? Okay. Okay. Great. About that. About that sound. Hear that? Wonderful. I want you to close your eyes for me. I want you to tell me how many times I make that sound. Okay. Good. Excellent, you can open your eyes. Can you hear that? Good. I'm just going to pop those in. Now, once these are all in, as you can hear, they make a pop sound. Can you hear the pop sound? I'm going to push different amounts through, and I just need to tell me how many I pop through. Okay, I'll just finish pushing these through first. Perfect. You can leave your eyes open first. Okay. Okay, close your eyes for me. Great, can open your eyes. Can you hear this? Can you hear all that? Good. How about that? Okay. So all those sounds, did they all sound the same, equal? Was one side louder than the other? How was it? Okay. Yeah. Okay. Right. Next test. Hear that? That. Great. I want you to tell me which side you can hear. Okay? Good. Perfect. I thought you'd say that. Everyone does. Wonderful. Just going to whisper a few words in your ears and I want you to repeat it. And then we'll move on to the pure tone test. Okay. Sausages. Ear. Chocolate. Cucumber. Pineapple. Stitch. Good. Hello. Good. Banana. Puppy. Story. Cat. Tree. Helicopter. Spritz. Spray. Simple. Difficult. Okay, now I'm going to raise my tone. Obstacle. Attraction. Beautiful. Good. Pleasant. Happy. Spray. Sleepy. Sticky. People. Garden. Okay. Now I'm going to turn around and whisper 3 words and then I'm going to speak 3 words. Just let me know. Okay. Lavender. Headphones. spritz, holiday, phone. Okay. Right. Now, that is complete. I'm going to just set you up for the pure tone test. Okay. So, let me just do this. You feeling all right? Good. You're doing really well. All right. This is where we really get into the nitty gritty now with this test. Okay. And that one. Great, my love. I'm going to be filling out this sheet. If you look there, so this is an audiogram. Okay, so I'm going to play a series of beeps to you. They're going to be different pitches. Some you'll hear, some you won't, as a standard. And this is going to just test, obviously, your hearing. And there's different levels, whether you've got normal, mild hearing loss, moderate, severe, or profound. Okay, you definitely haven't got profound, and I wouldn't say you've got severe because you can hear a few things, all right. I am suspecting some mild hear loss from the test that I've done today, all right, but this beep test will really, really help. So what I'm going to do, I've got to give you these headphones, all right, and you're going to place these on. You're not going to be able to hear a thing with these because they are extremely amazing soundproof headphones. All you're going to hear is the beeps. All right, so I'm going to give you these headphones. I want you to pop them on. I'm going to leave the room. You can either keep your eyes open, you can keep them closed, it's totally up to you. I just want you to sit there and listen. Every time it beeps, if you can just press a buzzer, which I'm going to give you in a moment, just keep nice and still and concentrate. Okay, and I'm going to be out the room. I can't be in here with you. And the system is going to obviously track it, but I also will be writing down as well. All right, my love. Do you have any questions about any of that? Excellent. So let me just give you that. There is the buzzer. Okay. Here are the headphones. You want to pop them on. All right, my love. So, do you have any questions? Are you sure? I know I've asked you once, but I want to double check. Marvellous. So, my love, you just relax. Once the test is complete, I will come back in, so don't worry, I'm not going to leave you sat there waiting. Okay. I'll see you in a moment. Thank you very much. How's that? Great. So I've got a copy of this before I came in. We have to print it in the other room, so it will go on your file, but I thought I'd print a copy to show you. So if you can see here where the crosses are, they are going up and down. Okay, and the other one. Okay, so you are experiencing some mild hearing loss in both ears. I'm thinking you're slightly a little bit worse in the one than the other. Okay, so this would mean that we'll need to start getting you to wear hearing aids. Okay. So I highly recommend that you do wear hearing aids, but it is totally up to you. At this stage, you know, it's quite mild, but I think it's good practice, okay? But it's totally up to you. So this is the ones that you would get free on the NHS. You can see they're very basic and they can become quite uncomfortable, but it's important to wear it properly. So these beep and different things like that. You pop a battery in, which goes, if I can open it with my gloves on. So the battery compartment is there, with battery in. This bit goes inside the ear, and then it fits round the top of your ear. So let me just show you on this one, okay? So round the ear, and I'm going to pop that in. Right, if you can just have a wiggle around and just really push that bit in, it will feel very strange, but it has to go further than you think, okay? Yeah, is that comfortable? Weird, yeah. So this little bit here, we can just push it there. Much better. Yeah, I know, exactly that. It's going to be one of those, isn't it? Let's try the other side. Okay. Pop it round. Push in and pop that there. Again, if you can just fiddle around. And just check. Right. How's that? Okay. Yeah, bit weird, not used to it. Yeah, it's finding the right balance on where to push it in. Okay, so if I just take that off, and that one, okay. So my advice would be to arrange an appointment with myself and we'll go through different hearing aids, okay? Yeah, so I've got all sorts of different ones, but they are at a cost, okay? And obviously the real good ones obviously going to cost quite a lot of money, all right? But they're there for you if you would like to. And those obviously are your standard ones that you can take away with you and just play around with it a little bit and see what you think. So I think you should do that, okay? There for you. If you go to the reception, they will give you a big pack of batteries and some information leaflets, but these ones are all right for you. Okay, then book an appointment with them, come back to me, and we'll go through all the different hearing aids and see which one suits you, all right, and which one you feel comfortable with and all sorts like that. Then we can make sure, you know, you've got the adjustments and the right settings and things like that. But with these ones, I just want you to get the positioning correct, okay, and see how things sound. A bit of a magnifier for the sound, if you like. Okay, yeah, good. So, my love, do you have any questions for me today? Are you sure? Okay. Well, you did absolutely amazing and you were very patient, so thank you very much. How are your thoughts on this? Yes, you did suspect. Okay. Well, it doesn't mean that it's going to deteriorate very fast. It could be a slow process. It could just stay the same. So I really wouldn't worry. All right, my lovely. Okay. But yeah, just practice trying them on, getting them comfortable. Then we can come back. And then, like I say, it's up to you if you want to wear them. All right. But if you're going to pay for them, I would highly recommend you get the use out of them. Okay. Yeah. I mean, if you want to just kind of wear it when you're having difficulty and then not the rest of the time, that's totally down to you. But we can have a chat about that. All right, my lovely. You are very, very welcome. You take care now. Bye-bye.